Good afternoon, everyone. Welcome to the WebEx. We'll be just starting here in few minutes. But before we get started, I just want to go over a few important tips. Please follow the instructions on this screen if you're having any difficulty logging in. Secondly, I want to emphasize that please enter your name, your practice name, and number of participants from your practice in the chat window on the right. If you're unable to see the chat window, as you can see on the screen, you can go to View on the top and then Panels, Manage Panels, and click on Chat. And in order to add the chat window, you click on Chat and then click on the arrow to move it to the right so you're able to see the chat window on the right. Please feel free to use the chat function. If you have any questions during the presentation, we will also be having few minutes question and answer session at the end of the presentation, and we'll be more than happy to address any questions that you may have after the presentation through email, as you all have my contact information, and we'll be able to address any questions later on as well. We're going to go ahead and get started. I'm going to mute everyone's phone lines, and we'll reopen the phone lines at the end of the call. I want to thank all of you for joining us this afternoon. I want to take a moment to introduce myself. I'm Mandy Kaur, one of the Clinical Applications Coordinator at MPRO. I completed my Bachelor's in Business Administration and Information Systems Management from Wayne State University in Detroit. I recently finished my Master's in Public Administration with concentration in Healthcare Administration from Oakland University. I'm working with MCEDA and also the lead on the Prevention Learning and Action Network. Our other speaker for this afternoon is Kevin Townsend. Kevin is a medical outcomes specialist with Pfizer, where he's involved in provider education and outcomes research activities. He completed pharmacy school at the University of Michigan and a pharmacy residency at Duke University Medical Center. Kevin's professional and research interests are in the areas of patient-centered medical home, cardiovascular disease, and medication adherence. Allow me to introduce the MPRO organization. MPRO serves as the federally designated quality improvement organization for Michigan under contract with the U.S. Centers for Medicare and Medicaid Services. The work we do under this contract is called a scope of work, and it lasts for over a 3-year period of time. Currently, we are in the 10th scope of work, which runs from August 2011 to July 2014. In addition to the physician and hospital settings, MPRO also performs independent dispute resolution, external quality review, and lastly, we have a beneficiary protection division. One aspect of the current scope of work involves the Prevention Learning and Action Network initiative. We call it the Prevention LAN, and that is why you all are here today. The call today is based on improving patient adherence through health behavior change. I will be talking about the next few slides, and then Kevin will take over with the rest of the presentation. Kevin's presentation material is developed by Pfizer. The focus of the LAN initiative is on patient and family engagement, clinical decision support and quality improvement, physician quality reporting system and meaningful use, and to foster a community of collaboration and identifying best practices, interventions, and tools. What are we trying to achieve? We are trying to achieve better patient outcomes and improve quality of care. There are different definitions of quality in care, and according to Institute of Medicine, quality of care is the degree to which health services for individuals and populations increase the likelihood of desired health outcomes. So how do we get there? How do we achieve quality? Quality is definitely an ongoing process. It's a continuous process. According to Mosby's Medical Dictionary, the definition of continuous quality improvement is a system that seeks to improve the provision of services with an emphasis on future. The improvement is ongoing. One important aspect in achieving better outcomes is the improvement of patient adherence. Why is patient adherence important? The patient must follow the recommended regimen. Improved healthcare outcomes largely depend upon a patient's adherence to recommended treatment. According to the National Institute of Health, in some chronic disease conditions such as cancer, diabetes, cardiovascular diseases, more than 40% of patients sustain significant risks by misunderstanding, forgetting, or ignoring advice. So how do we address patient adherence? Through acceptance and understanding. This is a mutual relationship between providers and patients, and it's based upon patients' knowledge and understanding of the condition as well as the treatment. The clear and thorough communication between providers and patients, and also the trust in the therapeutic relationship. Knowing the patient, not just as a patient, but then knowing the patient as a person is the key here, which includes knowing their beliefs, attitudes, and cultural context, and social supports and emotional health. Why is it important to engage our patients? And I love the definition by NCC, National Coordinating Center. I think it's a very well put together. Knowledge is power. An engaged patient is an empowered patient, more likely to adhere and follow instructions because they own it. So how do we engage patients? There are many ways, and for those patients who prefer technology, there are several apps on smartphones like automatic patient reminders or apps that provide health-related feedback. Centers for Disease Control, CDC, and CRUST also has links, and we will be more than happy to provide you these additional tools and resources. According to the survey done by MedTech Media, the majority of patients surveyed are more likely to use an interactive app that can analyze logged information and provide feedback. Ease of navigation was the top feature. Most were interested in using a health app to gain information. On this slide, we have included some interactive patient tools for provider use, such as interactive adult scheduler for immunizations, and the link on here. I'm just going to go ahead and click on this link. And if you scroll down to the adult immunization schedule, I'm going to go ahead and click on that, and you will see in the middle of the screen here, there's a poster here. So here you will find posters, interactive schedulers, and even a smartphone apps available for your patients. On this slide, you'll see additional patient education materials such as patient engagement, which are disease-specific, so it's condition-specific educational materials. And if I go ahead and click on this last third link here on this slide, and you'll see, as it says, topic condition-specific. So all those education resources are on this site, and you'll find for educating and engaging both the patient as well as the patient's caregivers. It is well-known fact that caregivers and family members can play a vital role in the success of a patient's treatment plan. And please be sure to visit MPRO's website section devoted to the 10th scope of work to improve health for populations and communities initiative overview. And we're going to go ahead and click on the link for MPRO. And as you can see here, we are trying to focus on these prevention measures: the breast cancer screening, colorectal cancer screening, influenza immunizations, pneumococcal immunizations, and improving cardiac health. And next time, please join us for more information on the Governor's Award of Excellence. We all know how much you love Governor's Award, and also to learn about the opportunity for CME hours. I do also want to mention that at the end of the presentation, there is a link, a survey link, and please do complete that survey evaluation. We do take our evaluations very seriously, and we have scheduled all these education sessions during the afternoon session between 12 and 1. But if you would prefer a different timing that works for you better and more convenient, please do let us know. Please do state that on our evaluation. And here is our contact information, my contact information, as well as Daniel's contact information. We both, Daniel and myself, are the leads on the Prevention Learning and Action Network. And if you have any questions or you would like more tools and resources, we'll be more than happy to provide that information to you. You can contact myself or contact Daniel. And now I'm going to go ahead and